Good afternoon, ladies and gentlemen. I am James H. McCall, independent and write-in candidate for your presidency of the United States in 2008. Thank you very much for taking your valuable time to view these videos. This message comes to you from Charlie's Restaurant in Bedford, Michigan. My presidential CD, my jingle, states that the security, health, and safety of the country and her society are main concerns which I have. I believe that our students, military personnel, seniors, children, and workforce of families must be physically and mentally healthy to ensure maximum contribution and participation in achievement and accomplishment. Article 1, Section 8 of the Constitution remarks that Congress has the power to provide for the common defense and the general welfare of the country. While there's no specific requirement in the Constitution to provide health care, I believe that the federal government may often enable or facilitate programs not necessarily mandated to be provided. We are all paying a high health care system cost, which is inadequate, confusing, fragmented, ill-administered, and complicated. Why not take steps to simplify health care and reduce the overall cost to everyone? Once the government has your money, it considers the money to be its very own, and therefore negatively refers to any health program as an entitlement program. In reality, ladies and gentlemen, if we're paying for it, we are entitled. Why let the states flounder in their various efforts to recognize the dilemma and to individually deal with it in a piecemeal fashion? My suggestion to consider a universal health care insurance program in conjunction with a universal ID card with photo, signature, fingerprint, blood type, and encoded password is hopefully worth your consideration too. This program would be funded by a national consumption or national sales tax, which everyone will pay. My program will cover wellness visits, emergency treatments, and all prescribed treatments and associated drugs. It will not provide coverage for purely cosmetic, optional, arbitrary, unnecessary procedures, enhancements, reductions, changes, or modifications. My program will have a 10% copay. That's an arbitrary percentage, but I believe the copay is necessary as it will encourage competition among the service providers, and it will also encourage comparison shopping by the patients. My program is for U.S. citizens only. Others must pay their own freight. Optional insurance coverage paid by the individual will be available to those who desire coverage over and above that which is physician prescribed or to cover the copays. Anyone may be treated anywhere at any time. The program provides complete patient choice based on care quality, convenience, and restraints. The cumbersome, separate, and costly systems of the Veterans Administration healthcare system, the Medicare healthcare system for seniors, and the workman's compensation system will virtually be eliminated. One's individual health records or histories will be available to any physician or care facility, anytime, anywhere, nationally. Fraud will be reduced, and check-in time at any care provider will be quick and simple. Present your ID card, which will be imprinted onto a universal one-page admission document, and you'll sign it. Imagine the time savings and cost savings for both the provider and the patient. This program, or this type of program, eliminates health care benefits totally from the employer's payroll equation. The government will merely facilitate the collection of funds and distributions to private enterprises, which are the insurance companies or the administrators. The approval and licensing of, say, 5 or 6 insurance administrators in each state will ensure their competitiveness in price and quality of service. We can encourage the drug companies to return to a massive educational and familiarization program to the physicians, as it once was, instead of spending tens of billions of dollars in direct advertising to patients who must go to the doctors anyway. One drug commercial is over 2 minutes in duration, mentioning many side effects from diarrhea to death and everything in between. A combination of current employee and employer health contributions may be added to the employee's take-home paycheck. There's no additional cost to the employers for redistributing this money. Then employees may save the additional money tax-free or spend and be taxed to fund the health care program. I believe that this type of program is essential, and I believe that it's inevitable. I've merely attempted to glean the facts and possibilities in this address of a major issue. It's not perfect, but we must have a beginning before we can have an end. Anytime that the positives far outweigh the negatives, a concept should be thoroughly and openly investigated. The government's role in any universal program such as this is to facilitate it and to monitor it for interstate equality, effectiveness, and availability. There may be other benefits to a universal health care insurance and ID program on which I'll be glad to elaborate. Thank you very much.